masking have been over for a long time, but we continue to see long-lasting effects of the pandemic.
The Journal of the American Medical Association is looking into this. Their recent study finds COVID was especially harmful for young girls' mental health, even noting this issue in girls from relatively higher income backgrounds.
And our Danny Travis looked into that study for us.
This study mainly shows the need for mental health services such as treatment for depression and anxiety in girls between the ages 10 through 18. And while there was already a steady rise in the need for those services before the pandemic, the study says that there's been a 30% increase nationwide in young girls seeking help now, and locally is no different. Dr. Elssy Oms, a pediatric psychiatrist at Delray and St. Mary's Medical Centers, says the younger group of girls were the most surprising here locally. She says girls less than 13 years old is where they're seeing an increase in suicidal thoughts, something not noted before the pandemic. And during the start of the pandemic, Dr. Oms says there was a drop in girls seeking treatment, possibly from many people staying in quarantine. As COVID restrictions eased, more young girls sought out treatment again in larger numbers. Now local doctors are feeling the strain as there's a lack of treatment available.
That combination created a marked spike in treatment needs for depression and anxiety mostly. We saw a lot of increase in suicidal behaviors, thoughts. The emergency room visits were difficult to meet all the demands that were in the community. And so now we're seeing the long-term effects of that situation.
Dr. Oms says if your loved one is struggling with mental health related symptoms, to confide in someone you trust and seek professional help.